Hello, and welcome to the Chest Journal's Editor Highlights podcast. Each month, Chest Editor-in-Chief Dr. Peter Mazzone highlights key articles from the current issue of the journal to help clinicians stay informed about new research in the fields of pulmonary, critical care, and sleep medicine. To introduce this month's episode, here is Dr. Peter Mazzone.
Thank you for tuning in to the Editor's Highlight podcast for the June 2025 issue of the journal Chest. There's a great lineup of diverse content in this month's issue. Over the next 15 minutes, I'll provide a brief overview of key manuscripts published in each of our content areas. This month in our asthma content area, we have a research letter that explores the relationship between exacerbations in moderate to severe asthma and the stability of fractional exhaled nitric oxide. Next is our chest infections content area. The prevalence of non-tuberculous mycobacterial pulmonary disease is rising globally. In this issue, Evan Dar and colleagues report on the prevalence of non-tuberculous mycobacterial pulmonary disease and mycobacterial simiae in northern Israel. They include factors associated with mortality from a retrospective cohort of lab-confirmed non-tuberculous mycobacteria occurring between January of 2010 and March of 2021. 1,968 isolates from 1,501 people showed that the relative abundance of Mycobacterium simiae and MAC increased over the study period. Factors associated with mortality included age, male sex, and immunosuppression. Mycobacterial simiae was associated with elevated mortality compared to MAC, with a hazard ratio of 1.84. These findings show that Mycobacterial simiae is prevalent in Israel and may be more pathogenic than previously considered. Our COPD content area is next. The effects of morphine during sleep, when used to reduce chronic breathlessness in COPD, are unclear. In this issue, Altry and colleagues report findings from a randomized, double-anonymized crossover trial of sustained-release morphine versus placebo in 19 breathless people with COPD. The study was designed to determine the impact of low-dose morphine on sleep efficiency and other sleep parameters. Sleep efficiency was similar between placebo and morphine, as was the frequency of sleep-disordered breathing events. Morphine reduced the mean and nadir overnight oxygen saturation. Mean transcutaneous CO2 and the number of participants meeting criteria for nocturnal hypoventilation increased. Breathlessness and next-day driving simulator performance were unchanged. These findings suggest that morphine does not change sleep efficiency or next-day alertness, but may cause hypoventilation during sleep when used in breathless individuals with COPD. Also in this section is an original research article evaluating plasma protein biomarkers of spirometry measures of impaired lung function, a systematic review and meta-analysis of preserved ratio impaired spirometry prevalence, risk factors, and outcomes, and a chest narrative review on the determinants and outcomes of education and pulmonary rehabilitation. Next is our critical care content area. The optimal PaCO2 target in patients undergoing VA ECMO after out-of-hospital cardiac arrest is uncertain. In this issue, Izawa and colleagues report findings from a multi-center, registry-based observational study of 1,454 patients designed to determine if PaCO2 levels are associated with functional outcomes in patients receiving VA ECMO after out-of-hospital cardiac arrest. Compared with high normal capnia, CO2 levels between 40 and 50 millimeters of mercury, low normal capnia, 30 to 40 millimeters of mercury, was associated with worse functional outcomes in both initial and 24-hour PaCO2 analyses with an adjusted odds ratio of 0.56 to 0.59. PaCO2 trajectories ending in high normal capnia also had a higher proportion of favorable functional outcomes than those ending in low normal capnia, regardless of initial PaCO2 levels. These findings suggest that maintaining high normal capnia levels in patients with out-of-hospital cardiac arrest receiving VA ECMO may improve functional outcomes irrespective of the initial PaCO2. Also in this section is an original research article that explores the role of the ventilator bundle, ventilation practices, and healthcare staffing in ventilator-associated pneumonia in low and middle income versus high income countries, a population-based cohort study that evaluates long-term mental health morbidity in adult survivors of COVID-19 critical illness, and a research letter describing pre-hospital cricothyroidotomy for emergency airway management, as well as a chest narrative review of an ultrasound-guided physiologic framework for evaluating a patient's volume status. On to our diffuse lung disease content area. The effect of pulmonary rehab on survival in people with interstitial lung disease is unclear. In this issue, Doman and colleagues report findings from the combined data of 182 participants from 2 previous randomized controlled trials of pulmonary rehab in interstitial lung disease. The study was designed to determine if participation in pulmonary rehab impacts survival amongst people with interstitial lung disease. The median survival of those who completed pulmonary rehab was 6.1 years compared to 4.7 years in those who did not participate in pulmonary rehab, a difference that did not reach statistical significance. After adjustment for baseline variables, at 5 years, completion of pulmonary rehab was associated with a 44% lower risk of mortality. There was no difference at 10 years. These findings suggest that participation in pulmonary rehab among people with interstitial lung disease may impact survival at 5 years. Also in this section is a multicenter study that evaluated the performance of lung ultrasound as a screening tool for subclinical rheumatoid arthritis-related interstitial lung disease, and a special features article that presents a historical perspective of the role of advanced imaging in the evolution of the diffusing capacity in lymphangioliomyomatosis. On to our education and clinical practice content area. It is unclear if the use of non-invasive ventilation during the post-operative period after heart surgery can impact the incidence of pulmonary or heart failure. In this issue, Goret and colleagues report findings from a prospective, randomized, monocentric trial of 216 patients at risk of postoperative complications, designed to determine if the use of non-invasive ventilation for 5 days before and 5 days after cardiac surgery is associated with a lower rate of acute pulmonary complications, such as atelectasis, pneumothorax, pneumonia, and acute respiratory failure, and cardiac complications, such as acute heart failure, arrhythmias, myocardial infarction, and cardiac tamponade. The composite outcome of predefined and adjudicated cardiorespiratory complications at 1 month after cardiac surgery occurred in 55.1% in the non-invasive ventilation group and 79.8% in the control group, for a relative risk of 0.69. No difference between the groups was found for intubation need and length of hospital stay. These findings suggest a reduction in postoperative cardiopulmonary complications with the use of perioperative non-invasive ventilation, but similar intubation need and length of hospital stay. Completing this section is an original research study that explores the association of lung function with visceral adiposity and skeletal muscle mass. Our pulmonary vascular content area is next. The effects of comorbidities, particularly cardiovascular, on the response to pulmonary arterial hypertension treatment are not well understood. In this issue, White and colleagues report findings from a post-hoc analysis of subjects from 2 phase 3 studies of people with pulmonary arterial hypertension, TRIUMPH study and the FREEDOM EV study, was designed to determine if cardiovascular comorbidities in patients with PAH influence the efficacy and tolerability of inhaled or oral treprostinil. Study subjects received inhaled treprostinil had a similar improvement in 6-minute walk distance and reductions in N-terminal proBNP, regardless if they had 0, 1, or 2 or more cardiovascular comorbidities. Those receiving oral treprostinil had a reduced risk of clinical worsening, regardless of comorbidities. Adverse event profiles did not differ with the number of comorbidities. These findings suggest that patients with pulmonary arterial hypertension and cardiovascular comorbidities can benefit from combination therapy with inhaled or oral treprostinil. Completing this section is a research letter detailing factors associated with high intrathoracic pressure in obese patients undergoing right heart catheterization. Next is our thoracic oncology content area. The management of patients with pulmonary subsolid nodules that are mostly ground glass remains controversial. In this issue, Lee and colleagues report findings from a retrospective cohort of 1,676 patients, 67% of whom were treated with surgery and 33% with observation. The study was designed to determine if upfront surgical intervention leads to higher survival than watchful waiting in patients with subsolid nodules 2 centimeters or less with a consolidation tumor ratio of less than 0.25. The 5-year event-free survival rate in the observation group was 100% across all subcategories. The 5-year event-free survival rate in the surgical group ranged from 97.4 to 99% across all subgroups. These findings suggest that in patients with subsolid nodules 2 centimeters or less and a consolidation tumor ratio of less than 0.25, watchful waiting may be more appropriate than upfront surgical intervention. Completing this section is an evaluation of the diagnostic performance of the modified LUNGRAD scores in tuberculosis endemic countries from the Korean National Lung Cancer Screening Program. I encourage you to read our Humanities in Chest Medicine section, where you'll find an original research study on how clinicians use quotations in goals of care notes, as well as our commentary series, where you'll find a description of the usefulness of cross-legged panel models for clinical research. Finally, please review our case series publications for the month, which provide novel and educational cases to help improve your clinical skills. I hope you enjoy reading all of the high-quality content available in this month's issue of Chest. As always, I'm grateful to the authors of this work, the reviewers who volunteered their time to improve the quality of these manuscripts, and to our editorial board for guiding everything that we do. Until next month, I hope you enjoy the June issue.
Thanks for listening to the Chest Journal's Editor Highlights podcast. You can find the articles mentioned in this podcast and more on chestjournal.org. And if you're looking for more context and commentary on articles in the current issue, please check out the original Chest Journal podcast, which features in-depth discussions with the authors themselves. We'll be back again with more Editor's Highlights next month.